Now I want to talk about traps for just a minute, and I call these traps because these are issues that we see sometimes students have challenges with. So we're identifying what this trap is so you can stay out of it. First of all, we talked about that assessment and implementation. And with the assessment, there's a couple of things that you're going to look for in the stem of the question. The first is there any nursing assessment in the stem of the question? If there is no assessment, well then maybe you want to think about selecting an assessment answer, but it has to make sense. Sometimes they will give incomplete assessment and the nurse needs to validate. For example, maybe again you're working in the outpatient clinic and you have a patient who has type 1 diabetes and they call you and they say, man, around 11 or 12 o'clock I'm really shaky. I have this feeling of cold and clammy, just something's not right. Well, the nurse may think, okay, ask about the kind of insulin. This is the time when the onset of the insulin is, and I may be concerned the client may be having an insulin reaction. But do you want to make that decision based on just what the client has told you? You do not. You want some sort of objective measure, so you would want to obtain a blood sugar. So this would be an example of an incomplete assessment that requires validation. Now, another trap is sometimes they just simply put the wrong assessment down. There's no assessment in the stem of the question, therefore I need to assess, and then you read your assessment answer and you're not sure it's right, but you think you need to assess right now, so therefore you make up a big story to why you're going to assess the client. If the assessment is incorrect and it's all you've got, then it's time to implement. So move on. So again, this is all about your discrimination. Another trap is first does not always mean assessment. So just because they say which action should the nurse take first, and you say, first I need to assess, I'm going to pick an assessment answer. Guys, there's no clinical reasoning in that. There's no critical thinking. Anything you do like that, understand that you're just picking an answer. Now, the other trap is action does not always mean implementation. And this is important for you to know too. So when they ask what is the first action, don't assume it's an implementation, and don't assume first action means that you automatically assess. You don't automatically do anything when you are answering these higher level questions any more than you automatically do something for the client. You want to think through all of your answers and select the very best response. Now let's talk about evaluation, and I alluded to it when we talked about a way to help you establish priorities is if you can only do one thing and then go home. I'm pulling it out again now because this is one thing that we see that weaker test takers don't do. They will read the stem of a question, decide what the answer is, and then they will pick an answer without thinking about, if I do this, what will the outcome be? It's important on each one of your answer choices you determine outcomes. And that's why that if I do this and then go home, what will the outcome be? So important that you determine the outcome and you make the decision based on that outcome. Always ask yourself, is this a desired outcome? Yes, no question. Yes, no, maybe. If you say, yes, this is a desired outcome, you would leave it in for consideration. If you decide, nope, it's not a good outcome, then you would eliminate it. So make sure you're always answering the question. And you use evaluation if your answer choices are all implementations or all assessments. So what you will do is, if all of your answer choices are assessments, you'll work your way through, are there physical or psychosocial ones here? If they're psychosocial, you'll eliminate them. Do the ABCs apply? If they don't, then you go to determining the outcome. And frankly, this is a part of the thinking that you're going to use on almost every question. It's really important, and that's why we've pulled it out in this way. Now I'd like to recap. You're going to use these rules not as absolutes, but they're going to help you identify patterns in your answer choices. Critical thinking is about seeing patterns, identifying those patterns. And the more you can do that, the more likely you are to select the correct response. So that's what you're going to use the rules for. Don't use them as absolutes. You said that pain is always a psychosocial answer, and I think pain is the right one here. Okay, as long as you have thought through it. So all of these rules are going to help you identify patterns in the answer choices to help you correctly answer questions. Be confident you are preparing with the best. We know that this is a really stressful time for you, and Kaplan is here with you, and we are going to help you through this experience.